let's now move to our first panel. I would like to invite Sean Petitpas, I'm switching from French to English here. Director of Community Engagement at the British Columbia Automobile Association, to say a few words, as BCAA is the generous sponsor of this Cannabis Impaired Driving and Road Safety panel. Sean?
Good morning. BCAA is pleased and honored to be able to sponsor today's cannabis panel. So thank you all for being here today, and thank you for this opportunity. BCAA and CAA have a long and very proud history of protecting British Columbians and Canadians on the road and at home. With cannabis legalization on the horizon, we truly feel that we have an obligation, a duty, and just a new way of looking at things, because things are going to be a little bit different after legalization, and we want to ensure that we're helping to keep people on our roads and our communities safe. In a recent poll conducted by our CAA national office in Ottawa, it was found that 71% of Canadians are concerned about road safety once legalization occurs. So that in itself tells me that we need to do something about this. But what's even more startling is another statistic, and that's 20% of 18 to 34-year-olds think that they drive the same, if not better, when they're high. So we know that's not true, but we also know that something needs to be done about this. So in the coming months, BCAA will be launching a very comprehensive campaign, education campaign, aimed at this target audience and aimed at changing those behaviors. So together, all of the organizations in this room share the same passion, share the same obligation and feelings towards this topic. So we're very pleased to be here today. I'm very pleased to be here today, and I look forward to this very exciting panel. So thank you.
Thank you. Now I'm going to leave you in the really good hands of Brian Jonah, who will be moderating this panel.
We know that the research indicates that people who are driving while under the influence of cannabis do have a greater risk of being involved in a collision. I guess the question we have to ask this morning is, are we ready for the legalization of the recreational use of cannabis? And what's the impact going to be in terms of impaired driving and collisions? How are we going to deal with that problem? So to address this topical issue this morning, we have 4 expert speakers. I'm going to go through each of their biographies first, and then we'll have the first speaker come up and do their presentation, and then the others will follow him. After the presentations, we're going to have a period of time, probably about half an hour, for questions and answers, and we'd like to hear from you about what your concerns are and have the panelists address those. So first of all, our first speaker this morning will be Doug Bierness. Doug received his PhD in psychology, specializing in alcohol studies, and a master's in addiction studies from the University of Waterloo. He currently serves as a senior research associate with the Canadian Centre on Substance Abuse and Addiction in Ottawa, and he also works as an independent research consultant. During his career that has spanned over 30 years, he's participated in a variety of research studies and has published numerous articles in the areas of drug and alcohol impaired driving, the Drug Evaluation and Classification Program, ignition interlocks for impaired drivers, young drivers, the development of high-risk lifestyles, and the perception of intoxication and impairment. He has served as the chair of the Transportation Research Board's Standing Committee on Alcohol, Drugs, and Transportation, and is currently the vice chair of the Canadian Society of Forensic Science, Drugs, and Driving Committee in 2016. In 2016, he was recognized by the International Association of Chiefs of Police on Drug Recognition Experts section as a DRE ambassador. The next speaker after Doug will be Paul Bowes. He graduated from York University in Toronto with a bachelor's in sociology and psychology, and then he graduated from the University of Toronto with a degree in psychology, a master's degree. In 1987, he joined the Ministry of Transportation and Communications, Ontario, as an assistant research officer. And in 1990, he was promoted to a senior research analyst. In this capacity, he worked on the annual collision statistics as well as a number of safety-related projects, such as graduated licensing and the speed cameras. In 1999, he joined Transport Canada as the chief of the Road Users Division, where he's responsible for research related to road users. His current affiliations include the board of directors of the Canadian Association of Road Safety Professionals. He's a member of the Road Safety Research and Policy Committee of the Canadian Council of Motor Transport Administrators. And he's also the co-chair of the strategy to reduce impaired driving, as well as the National Occupant Restraint Program, which are task forces which are part of CCMTA. Our next speaker will be Darren Grondell. He has a Bachelor's of Arts degree in Political Science from Brigham Young University, a Master's in Public Administration from the Evergreen State College, and a doctorate in Organizational Leadership from Brandman University. Darren is a graduate of Northwestern University, the School of Police Staff and Command. Darren began his career as a trooper with the Washington State Patrol in 1992. He was promoted through the ranks to a captain with varying job assignments, leadership, and management responsibilities. In 2009, he was nominated to the Governor's Distinguished Managers Association, and in 2012, the Governor, Christine Gregoire, appointed him as the director of the Washington Traffic Safety Commission. And then in 2013, Governor Inslee reappointed him as the director of that commission. Director Grondell is an active member of the Governor's Highway Safety Association, and he's he's serving as the secretary of the board of that organization. He enjoys all sports and spending time with his family and 10 children. That must spend a lot of time with 10 children. Our last speaker is Jeremy Wood. He is currently the project director of the Drugs and Driving Initiative at the Road Safety BC. Jeremy recently led the development of Bill 17, the Motor Vehicle Amendment Act in 2018, which provides additional administrative tools to the police in British Columbia to address drug-affected driving. The Drugs and Driving Initiative will work to implement Bill 17, as well as lead the development of a second phase of the legislative changes to further strengthen the BC provincial laws to deter drug driving. Jeremy has worked in the public service in various roles for more than a decade. He started with Road Safety BC in January of 2016 and is very passionate about impaired driving, distracted driving, and other public policy areas affecting safety. Jeremy's previous work in the policy and legislation field included a number of projects aimed at overhauling police accountability. Most notably contributing to the establishment of the legal framework for the Independent Investigations Office, which investigates incidents of death and serious harm involving police in British Columbia. So those are the backgrounds of our speakers. As I said, we're going to have Doug Bierness come up first and talk about the prevalence of cannabis in collisions.
Thanks, Brian. If you listen to Brian carefully, he made me sound really, really old. And the beauty of that is when I first started in the field of traffic safety way back when, drugs and driving was not an issue. We didn't really even consider it. We knew that there were cases where drugs were involved, but it really wasn't a big deal, and we didn't pay that much attention to it. Alcohol was the primary concern. And if you take nothing away from my presentation today, it's that that situation has changed. And the focus now is on drugs, particularly in light of the cannabis situation. So I was asked to talk about what we know about cannabis and driving, and more generally drugs and driving. And the way that I like to do this is to talk about three different populations: the quick, the caught, and the dead. First of all, the quick. The quick is an Old English term for the living, for those of you who pay attention to such things. We don't tend to use the word too often these days, but when you look at people who are driving after using drugs, we look at a couple of things. One is self-report data. We ask people how often they do it, and we can also look at drivers on the road through roadside surveys. The caught are impaired driving incidents. The dead are drivers in fatal crashes. I've avoided talking about the injured drivers and their drug use, and I'm going to leave that to Jeff Brubaker, who will talk later on during the conference about the work that he's doing with drivers who end up in the hospital. So to start with, these are some data from a national survey done by Health Canada over the years, and it goes back to about 2008, and they discontinued those questions in the survey in 2012. And you see that driving after drinking really hasn't changed a whole lot over that period of time. And in fact, those who report driving after cannabis use hasn't really changed a whole lot over that period of time. So these data are limited in terms of what they tell us. 2012 was a long time ago in terms of cannabis. So we look at the Ontario Student Drug Use and Health Survey, which is done by the Centre for Addiction and Mental Health in Toronto. And this is a wonderful data set where they ask students questions they've been doing this for a very long period of time, so we get some good trend data going on. And if you look at the yellow bars, which is driving after drinking, you see that it's decreased substantially among young people over that period of time, from 2001 through to 2017. And interestingly enough, students also report a tremendous decrease in the proportion of them who report driving after using cannabis. Self-report surveys are interesting because it's people who tell us that they do it. More interesting, however, are drivers who actually do it. So to do this, we do roadside surveys. Drivers are randomly selected from the traffic stream during nighttime hours. We collect breath samples from them to determine alcohol use, and oral fluid samples to determine drugs of interest, major drugs of interest in those samples. Now, just so we're clear, we're not doing oral fluid screening at roadside. We're collecting samples and sending them to a lab in California who tests them for drugs subsequently. The response rate in these surveys is actually quite high. 80 to 90% of drivers comply with our request for a breath sample and an oral fluid sample, which is really quite surprising. The number one question I get about such surveys is, why on earth would anyone in their right mind give you these samples, especially if they've been using alcohol or drugs? The reason is they've never done it before. They're curious. It's something new and different. And we give them a gift card for $10 worth of free gas, which in the province of British Columbia buys you about 1.5 liters. But $10 is $10. The value of these surveys, it provides a very good indication of the prevalence of alcohol and drug use among drivers at night. So let's start with alcohol. These are some surveys that have been done. The first three here, 2008, 2010, and 2012, were done right here in the province of British Columbia. The subsequent two, 2014 and 2017, were done in Ontario. So they're not completely comparable, but they give us an indication of what's going on. If I can go back a little further, in 1986, the province of Ontario did a roadside survey, and they found that 19% of drivers on the road tested positive for alcohol. That's 1 in 5. These numbers don't show that at all. These are way below that number. In fact, in the most recent surveys in the province of Ontario, we're finding about 4% of drivers test positive for alcohol. So infrequent was alcohol in these surveys that after the first night, we pulled all our breath testers off the road and recalibrated them, checked the calibration. They were working just fine, thank you. So here's the cannabis numbers. When we first started doing these surveys in British Columbia, less than 5% of drivers tested positive for cannabis. And to a lot of people, that was kind of surprising. Wow, that's a lot of people smoking cannabis on the road. And they said, well, that's BC. Everybody smokes flower in BC. Then we got to Ontario. Surprise! People in Ontario use cannabis too. The interesting thing here is that cannabis now exceeds alcohol among drivers on the road. Not by a little bit. It's substantially higher. When it comes to the caught, these are people who are identified as being impaired on the road. And these are incidents reported by Stats Canada. There's a lot of numbers on there, and these include both alcohol and drug-impaired drivers. Those of you who are into this data realize that in Canada, we can't separate alcohol and drug-impaired driving charges. It's all one charge. It's the same number. So when you look at the official statistics, it's still a 253. They don't separate alcohol and drugs. So we have to put them all together. So these data are really, really limited. We have really poor data on drug-impaired driving incidents. Stats Canada tried to pull this apart from the Uniform Crimes Report Survey, and in 2016, they indicate that just over 3,000 of these were drug-involved. And that was up about 12% from the year before, so that was kind of an interesting increase that they saw. Now, that doesn't reflect necessarily an increase in the prevalence of the behavior. It reflects an increase in the prevalence of which these incidents are reported. The Iacp Annual Report on the Drug Evaluation and Classification Program indicates that in 2016 there were just over 3,000 DRE evaluations done in Canada. And a number of these were training evaluations. So they were done on people who were not necessarily driving. But of those, 467 were cannabis related. 606 were based on depressants, were found depressants in the person's system, but 686 were polydrug cases. That means there was more than one substance found in the individual. Drug-impaired driving often involves more than one substance. Cannabis tends to be one of the most common substances in those polydrug cases. The province of Ontario recently has been doing drug testing on all driver fatalities in the province. They didn't used to, but they do now. And these are some of the data that they have produced and made public. And there's a couple of interesting things here. Drug and alcohol-free cases, the ones in the red here, account for 28% of driver fatalities. Those are the alcohol and drug-free ones. They haven't got anything on board. That means that everybody else does. That's kind of scary when you think about it. If you look at this a little more closely, over there on the far left is THC alone with other drugs. Alone or with other drugs. And that accounts for almost a quarter of driver fatalities in the province of Ontario. The THC and alcohol cases account for just under 10%. And then the alcohol cases, either alone or with another drug, account for about 14%. These are some trend data from the CCMTA report done by TURF on fatalities in Canada. And by the way, BC is not included in the last several years of this. But you'll notice the red line there, that's the alcohol percentage of cases. And particularly interesting is when I first started in this field, that red line was 60%. 60% of fatally injured drivers in this country way back in the early 1980s was 60%. And now we're down to just under 30%. That's a huge reduction. Absolutely phenomenal when you think of it in epidemiological terms. However, if you look at drugs, there has been this sharp increase in the proportion of fatally injured drivers who test positive for drugs. Now, part of that can be accounted for by increased testing. Drivers weren't necessarily tested for drugs long ago. Now they are. The more we look, the more we find. Drugs are very common in fatally injured drivers in this country. So what can we say about all of these data? This is just a quick summary of some of it. Cannabis and other drug use is not uncommon among drivers in Canada. We find it all the time. It's very prevalent. And the other thing is we're still learning about this. We know this cannabis train is coming down the track, and we're trying very hard to keep laying the tracks so we know where it's going, so it doesn't get off the rails. We're going to continue to learn. When Paul talks about the laws, this is a first attempt to deal with this. Recognize that we have a lot more to learn when it comes to determining not only the prevalence of the behavior, but who's doing it and when and why. There are gaps in our data. There's no question there are gaps in our data. One of the things that we have to be really cognizant of is the fact that cannabis is more difficult to test for than alcohol. In retrospect, alcohol was easy. It was a very simple molecule, it's easy to test for, and we have easy ways of finding out about alcohol in drivers. We have some data gaps, not only data gaps, but the quality of the data isn't always up to par either, particularly the enforcement data. The way that it's captured and the way that it's reported doesn't necessarily distinguish well between drug-impaired drivers and alcohol-impaired drivers. We need better data in that sense. We also need better data on the who is doing it, when they're doing it, and why they're doing it. So we have a number of things that we need to do, and this is just an indication that tells us cannabis is out there, it's causing problems on our road, and we need to do some things about it. And that's it.